now we're going to reposition our client in this amazing position called sidelying. What a novel idea to use it outside of prenatal. So I can't begin to reinforce enough that we need to include this in our general practices much more often, or at least as an adaptation measure for people with a variety of issues. It can be, you know, my father had a really bad car accident, had spinal fusion and all this, and he couldn't lay him prone and supine. It was only sidelying. So, I mean, it's a very valuable thing. Also, regarding draping and all that stuff, I know there's some concerns there, but we'll see how the value of the other piece of draping material and correct bolstering can really help with this. Okay, so first, have your feet come up. I'm going to demonstrate, you know, something that I know is basic, but what we do with the sheet as we turn somebody over, that's where there can be maybe their hand flips up and hits you and all that kind of stuff. The way I position myself is not with, you know, the front of my body open to their upper body and their arms. I turn myself a little bit so that my lateral leg is acting as a buffer. And then if this is helpful in any way, the way I teach how to hold the sheet is to make sure, positioning of the sheet and how to hold it, making sure the sheet is fully covering the front edge of the table. I mean, worst case scenario, you know, you turn a person into a ghost and all that stuff, but we can't have the sheet all the way down here when we have somebody turned, obviously. Right here, pinning the sheet, holding it taut, not tenting it up like this, holding it taut, and then with this leg in my body turned in such a way, if they accidentally hit me, it's not going to be a weird thing or a big deal. All right? All right. Client, I'll have you turn onto your right side, your left side up. Good. Perfect. And see, even there, like an elbow, it did hit here, but it didn't hit my chest, all this stuff. I'm able to be kind of more guarded if I just position my body strategically. All right. Now, we're going to get ourselves all set up with the draping. This I know is something that can be an element of concern for therapists in sidelying. As I get this pillow position, I'm also going to remove this towel all at the same time. Now, would you want that a little bit more pillow, or is that about right?
That's good.
Okay. Now this sheet, find the edge, stand in such a way where you're not able to look down. In the event that the sheet does something weird, you don't want to be in a position where you could see the chest. Stand behind them for all of this, okay? Reach over the head, and then go and pick your head up for me real quick. Little tuck underneath their head. Now that's going to hold the sheet a little bit taut across the front of the body. I'm going to move all this stuff out of the way. Here's my biggest hack that I feel like saved me a ton of anxiety. And I did this with all clients. It did not matter, male, female, whatsoever, okay? This other piece of draping material, whether it be a towel or a blanket, would get unraveled. And if you already have a blanket included on top, then bring it up and do what I'm showing with it then, okay? All you gotta do is flop this over top of them like this. So even if this blanket had already been on top of that top sheet, now I can use this as this extra weight, and I can, you know, create all kinds of shapes and stuff with it to make working here so much easier. And the impression for the client the whole time is going to be that there's a level of diligence in maintaining modesty without it being finicky and all that stuff. So now what I have is this is to act as like a screen, like I can billow it and have it lay across the neck. I can ask the client to, can you bring your arm back for me? Okay, good, and on top. So that I'm able to get the arm on top. I could even have the arm on top of this sheet, I'll show here, because this is ultimately what this looks like with just that sheet. Tucked underneath the head, holds it against the chest a little bit better than pinned with their arm. But on that arm doesn't have to be undraped the entire time. I use this for coverage there. And then that just, I don't have to worry nearly as much, and they have that sense of security. We're really maintaining the modesty as much as possible with, like, you know, the torso, the chest to the pelvis. That's where we're trying to teach, or I'm trying to teach, strategies that make it really simple to feel safe and secure. And that's really all it takes. I don't care if it's even a towel. A lot of times it was just that. A standard shower towel can facilitate this. Then what that allows, obviously working here, if I work here at the head of the table for the neck and the shoulder, I have this additional weight and coverage so that it's clear for them that they're safe and everything's covered. I can work all through here, just showing some of the angles and stuff that I use. This isn't usually an area where you have to worry too much, but it is beneficial having this extra piece because I can be holding. She knows where my hand is, but I'm holding that sheet down while working here with the neck and up to the base of the skull. Even here, I can just hold the sheet down, making sure there's no gap, no draft, right? If we were working on the rest of the body, and when I turn, you'll see it better. But this is then also where, if I was limited to side lying, it's much easier to work on the arm. And then even the lateral side of the body. But here's the big one there. If I were to work on the low back, the lateral lumbar area, all of it, if I take this, make sure it's making contact with the front of the body and going across the neck. Another thing that obviously could be included here, but for visual reasons, it makes it a little bit bulky, is just bringing in another pillow. If we brought in another pillow and have them hugging that the whole time, and if we were sticking with side lying, that certainly is something that I actually do. If they're going to be in side lying for more of the session, then we have this, and that too is just creating more coverage and more comfort. And so not only is a person more comfortable, they feel more secure. What an amazing thing, right? So then here I can drape the entire back and work. I can work the lateral side of the body. Really important areas for clients, but with this pillow and coverage, I don't have to be worrying about making it inferent contact in the same way. I actually usually work like this, which sometimes my students have a very difficult time mimicking. The reason why I developed this, and I'm going to remove this pillow for a second, is they know where my arm is the whole time. I'm able to control their arm really well. And this hand can hold that whole sheet down right across their shoulder. And then I can work in latissimus dorsi. I come a little bit more lateral, serratus anterior, all of that. And I'm not making contact in the front and everything whatsoever. And the sheet is just really, really secure. And we'll see that better when I flip on the other side. Okay. So back. And if you don't already know about it, here's this amazing thing. All this ultimately is a 6-inch thick by about 8-inch wide chunk of foam. And that is what we teach and use. You can buy a twin mattress of foam off Amazon and cut them up. I usually get like 10 or 11 out of them, and we have lots of clients actually purchase them. All of our students end up grabbing them up too, but we end up selling them to many of the clients at the spa as well. And that just also creates a level of stability here where there's not going to be any slip, which is going to help with draping. In this position, an area, so we have this. If I didn't have that, then I have to be just, substantially more cautious. So I'm going to move this out of the way so you can see better. But draping the lateral leg in this position is an area where you have to be careful. And frankly, I find a way to work on the anterior lateral side of the leg, and in prone, I already did work on that posterior lateral side of the leg. So in my routine, unless it is all side lying, I don't usually have to worry here too much. But there have been many cases with athletes and, as said, with clients that do need to be in this position for the whole session. Here's the big tactic, big bunch. Make sure if I have to uncover the feet, that's fine. We can accommodate that and cover them up. Right here, I create a big enough bunch with the sheet to have a handle. And then I make sure I hug that against the posterior and anterior sides of the leg as I move this up. And because of that square bolster there, I can use that to kind of pin it. What we don't want is to have the sheet be taut and start moving it up and have these gaps where there's a potential perception even of them being exposed, right? So just bunch, contact, move, and it's no nonsense, very easy. You can work all through here, no problem. Here's a good example. Let's say I'm in a position where I know I want to work here, but there's potential part of their body that I am going to find myself bumping up against. Strategically just plant your hand in the way so your chest and or belly is going to just rest against your hand and arm and not just up on their body. This right here could feel like something awkward or be misinterpreted. If I do this and here, now we're in safer territory. Just showing the benefits of this position, how I can work the lateral sides of the leg. The knees here are so much better. I can be contacting and working basically every part of the lower leg in this position. Work on the feet is so much better. Client can breathe better. They can reposition to however is most comfortable for them. All of that. So huge win. And the benefit of having this also allows for being able to shape that for anything and everything. In the event, and I have had to do this, I've worked a lot with joint replacement. If I did have to drape here, I don't drape it in a prone or supine. I drape it here because I can use this, create a very kind of like a donut shape, and then I can maneuver the sheet in such a way to only undrape a very isolated region. And to be honest, the only times I've really had to do that is for working on scar tissue relative to hip surgeries or hip replacement. But this extra piece, what a thing. Wow. And then we'll show the other side. We already have our client positioned where that top sheet tucked underneath the head, help keep it drawn across the chest. Top sheet here, arm across. Again, if we needed to, pillow across the front. I'll show a little bit here for the back so you can get an understanding of how useful this top sheet is. And I mean, in the context of what we're really talking about for this presentation is more about making sure that we're avoiding that whole misinterpretation of contact so the person doesn't make a false claim against the therapist, right? So the easiest principle there is just to make sure simple things like draping are above and beyond what they may need to be, but this is so simple. I don't see why it's hard to teach and include. And then the mental emotional concern, because we all know if our mental and emotional mindset is stressed and concerned, that's going to translate into our touch. And if a person gets a sense that we're nervous, and that is a component from the emotional and interpretation side of this that also can lend itself to misinterpretation. I didn't quite phrase that right, but basically, if you're nervous, you might be perceived as being weird. We may want to limit that some, right? So here's where you see how I contact this. It doesn't have to be like that. Arm can go over top. Point being is that this allows me, while I'm doing this, to hold that sheet down and to create this very clear sense of security and coverage. This is for no other reason, for a sense of security for myself and for the client. So here, and I can work the lateral side of the torso, really get that scapula moving, all that good stuff. And then, if we bring the arm forward, and I could actually stick the arm underneath if I wanted to keep the client a bit more cozy. Arm can then go underneath that blanket, and I'll have you just roll a little bit forward for me. That's where that pillow is helpful for them to just kind of roll into that. But then, can you get a sense of how we could then work on sections of the back, the posterior torso, inside lying, with the draping being incredibly modest and clean? So here, show principles like this where I just, soft fist. I'm starting right at the erector spinae, and it is going downhill, but if they're rolled forward and there's not too much lotion, this works really good. I tend to actually just pin the tissue on one side like this. And the interpretation of touch when it's not open palm is beneficial in making sure we're not causing misinterpretation. So soft fist and forearms. Application of forearm here really works good. I'm standing away just so you can see how I can be holding. Hold on to the upper trap. Everybody wants more work there anyway, right? While I'm working the low back. Elements of working more in the scapular region. And this swings the scapula out more, so I can work here, here, here. It's very useful for a variety of reasons. And the draping does not have to be complex. It's this amazing thing. Okay? Now, another area that we weren't able to look at, I wanted you to be able to see it on this side, is this is an option aside from prone to work in the hip area. You can't include the joint movement quite as much, but since it's so much more on the lateral side of the body, it also does lend itself to it for the therapist. This is where we can have our students or therapists that from whoever's trying to learn and do better in our profession, giving them options, not just saying there's only one way to work on each body region. And everything, all the elements that attach to the pelvis, the glutes, tensor fascia lata, hip flexors, all that, essential things to be able to work on. So right here, what you may need, if it's a not adjustable table, a hydraulic table, is a step that allows you to come up and be a little bit higher. But this allows me to use my forearm, just so you can see. I'd be standing more like this. I just am able to work right around that greater trochanter and keep my pressure really focused around the hip joint proper, while still working on pretty much every muscle we can think of that's related to the hip. But since it's not prone, the applications won't be as much on gluteus maximus, and that might be just a helpful option. And you need this, let's say the client can only lay in side lying anyway, you need to know how to do this regardless. But then it just also becomes an option for a therapist. Which one do they prefer? Which one do they just innately feel more comfortable doing? Medial thigh. I had discussed how that can be a problematic region to be just considerate to in prone as well as supine. So if we can address it in Sidelying, I think it's very helpful. Now, showing draping, that bunch, making sure there's plenty of sheet between the legs. I don't have to be making any contact with their body as I do this. There should be a strong avoidance in teaching any of this of our hands making contact and going underneath that sheet. That's a absolute place where it's easily misinterpreted and justly so, and it needs to be avoided. Thus, my hands are not near the edge of the sheet when I'm doing this. Okay? Now, how do we work this area? It's going to come back to forearms, but then also considering our orientation and direction relative to this. So instead of open palms, and I can be strategic there, if I keep my applications going more distal and down towards the knee, you know, all that's going to have a different quality to it. But the problem is any open palm on that medial thigh going more superior or proximal, whatever terminology we need. But here, rather than a forearm always this way, and I tend to do this. I tend to plant my hand on this top leg so they know where I am. Other hand is on the lower leg, and then I'm working like this. And I'm using my forearm, and it's kind of just, you know, this can rest, and there's a pivot quality as I work. So this works pretty good for me. Hand can rest here, and I glide across like that. That works pretty good. Another option is to stand in such a way where I'm going to use this forearm and go proximal to distal. So starting high on the medial thigh, the adductor group, and go down towards the knee like this. I just am now aware that my angle might not be the best. So I'm going to show from here, and I'm going to move the camera. So showing that again, this allows me to incorporate joint movement with forearm application, and that way there's no even sense that we're encroaching and putting any part of our body between the legs. So just the forearm on that medial thigh, and then I can go back and forth. I use this quite a bit in athletics, for example, but I'm aware that a lot of the times, and I usually tend to be doing, you know, both of these applications, but if I'm picking one, I try to consider what's occurring with the lymphatic system. So this tends to be where the angle, I'm just letting you see how this hand can be set. They know where I am. Work my way up. And that's really all there is to that.